We are Group 13 and our video topic is healthcare. We will first be talking about general background information, then apply the IAD framework to private healthcare and give a real-world example. We will finish by talking about Obamacare in America and healthcare in other countries.
General information about healthcare. There are two different kinds of healthcare: employer healthcare and individual healthcare. Some companies will give health insurance to their employees. This is generally a very basic plan with very few benefits. The employees can get additional coverage on their own. The main reasons that companies do this is because they can get better deals than the individual workers on the insurance plans. Privatized healthcare means that companies can pick the price that they have for different plans. Consumers generally pay a monthly fee, and in exchange, the insurance company will cover some medical charges that the plan the consumer has chosen covers.
We will now apply the IAD framework for private healthcare. We will now discuss the exogenous variables of healthcare. Biophysical conditions. Plans are based on where you live, work, and attend school. Based on where you live, different insurance companies and doctors in different areas could lead to different plans. Based on where you work, companies offer different healthcare plans. Based on where you attend school, some universities will offer better deals for their students, staff, and alumni. Attributes of the community. Various social classes and incomes affect plans. Communities with wealthier people will generally have more expensive plans. The climate in which residents live also affects plans. For example, Arizona has a higher need for skin cancer and dehydration coverage. And finally, tobacco use and drug use is a major factor of healthcare plan pricing. Rules in use. There is a free market competition in which insurance companies use competitive prices to try and win over consumers. Obamacare in America has also changed many healthcare rules. We will go into more detail on that later.
The action situation part of the IAD framework. The participants: every legal U.S. resident. The positions: insurance companies, individual consumer, employer that provides health care to employees, and government regulators. Actions: individuals and employers choose company plans based on their health, employment, and financial abilities. Control and information: insurance companies have control over what plans they offer, and individuals have access to pricing and coverage information if they seek it out. Potential outcomes: pricing varies based on individual health needs. Net costs and benefits: more expensive plans have higher benefits. Employers receive discounts for buying insurance in bulk.
The final parts of the IAD framework are interactions, evaluative criteria, and outcomes. Interactions. There are 4 different ways to purchase plans: in person, online, by phone, or by mail. Evaluative criteria. Different pricing and coverage options are based on different health needs. Outcomes. Pricing varies based on individual health needs.
Real-world plan example. The insurance company here is Blue Cross Blue Shield. The deductible is $2,500. A deductible is the maximum amount of money that a consumer will spend on healthcare before the insurance covers the costs. There are many exceptions to that. A lot of care is covered by the insurance outside of the deductible. After the deductible is reached, the insurance will pay for 80% of the care, while the consumer will pay for the last 20%.
Obamacare. Obamacare has added many new benefits and rules to the American healthcare system. Some benefits are: children can stay on a parent's plan until they turn 26 years old. Insurance companies can't remove someone from a plan if they get sick or if they make a mistake on their application. They also can't reject people if they have a pre-existing condition. They cannot raise the price of health care for no reason. They cannot increase the price for women, which is gender discrimination, and they cannot limit amount of care you get over your lifetime. Individuals can also challenge company decisions. Obamacare subsidizes health insurance costs, makes simple plans affordable for all, but taxes are increased to make Obamacare available.
Other country healthcare. The following rules apply to France. The government will take 20% of a consumer's paycheck and apply it to healthcare and retirement plans. All doctor and hospital visits are free. Hospital visits will generally keep you hospitalized longer if necessary. Private insurance is still available. Employers often provide private insurance on top of the public insurance that is provided to all. The private insurance will generally cover things like optical and dental care. Purchasing medicine is reimbursed by the government.